to address you all tonight. So, this is a contentious issue, obviously, all over the nation. And as the county public health official, I'd like to echo, Phil's statements. I'm a child, basically, as a local health department of the Ohio Department of Health and the CDC, and the virus right now, the Delta variant, amongst other variants that are in our community, is highly contagious and spreading through airborne droplets. And the common sense measure would be a mask to stop any, or at least knock down the ability for the virus to float through the air and infect other folks. So, currently, the entire county, which we track syndromically by zip code and even drill down further, our transmission rates are through the roof. Almost 300 people per 100,000 are infected right now. So that means that the community spread is pretty rampant. The effort to wear a mask, and at least temporarily, what we're looking for is to, again, knock this spread down, get it down to a safer level, and move forward. So right now, obviously, it's been, the last week, it's been 98 degrees and 98% humidity. That's really supposed to hurt the virus, at least to knock it out of the air. The water droplets attached to it and drop it. The school season coming in now into September, and we're heading into the fall. The likelihood of the transmission, the spread, is going to be even greater. So we haven't seen the worst of these curves and all these other heavy terms we've all heard for months now. And I have to stand by and believe that the mask wearing would be something that would really help keep the kids in school. And the quarantine orders wouldn't apply to kids if they had the masks on, as long as they're not symptomatic. A sick kid's a sick kid. We have to get them out of the school until they feel better. But if we can work together and try to knock this down, I mean, that's the best approach we can. Last weekend, spent the entire weekend with the Sandusky administration, and they went virtual this whole past week, and it's a struggle. We all know that, and because of an outbreak that they had in the school environment. And I think we have a handle on that. It hasn't spread anymore, at least through testing. I don't want to see that for Vermilion. I don't want to see your kids or my kids not have school or extracurricular activities. Wearing a mask for a while is going to be a way that we can keep them in the school and keep them engaged in their extracurricular focus. So.
I think the athletes are going to end up being in school anyway.
I'm sorry, sir?
The athletes are going to be in school anyway, without masks on.
There's a lot of local issues that are out there.
I guess the question to you, the health commissioner, would you mind, can I ask you a question?
Yeah.
What's the difference between the child that has COVID that's wearing a mask, because, masks doesn't stop everything, we all know this.
Sure.
And a child that has COVID without one? It just looks like because the child didn't wear the mask, you're retaliating against that child versus one that's wearing
No,
one. Because they could still spread it.
Don't misread the key statement isn't that the kid.
But why? Why?
It's the symptoms we're worried about. It's the symptomology
But
we're worried about.
as a parent, your kid has COVID, you're gonna keep them home, right? We're gonna keep them home. Yeah, I keep
Right.
my kids home. At
Yeah.
least they're, the 5-6 stage large, so they're not really that contagious. And the kids, it doesn't hurt kids. COVID doesn't hurt kids. So I don't understand this.
Ma'am, that's not a factual
That
statement.
is factual.
No,
Yes, it
it's
is.
not. I'm not going
Yes, it is.
to argue with any of you. It's not a factual statement. We don't know the long-term effects right now. We're undergoing research studies.
Okay, that was my question.
How does that make sense?
Thank you.
What do you think
If you'd like to discuss it
No,
with me further.
that was my question, but it's clear what it is. Thank you.
All right, thanks, Mr. Schade.